Hi, Dr. Pelto here. I have a question I want to go over that a patient sent to me about a condition called posterior tibial tendinitis. And the question is, does shockwave therapy work for a grade 2 tendon injury, specifically tibialis posterior? We have a few things we have to go over to go into this question. We're going to talk a little bit about shockwave therapy, a little bit about tendon injuries, and a little bit about the tibialis posterior. Let's first talk about the tendon. This tendon, if you look at this image on the bottom, the tendon goes around the inside of the ankle, and there is a muscle belly on the lower portion of the leg of the foot. And the area that becomes painful is around, as it goes around the ankle. Normally when tendons become injured, it's the area either where they insert or where they curve. And this curvature going around a bony prominence can cause ripping or tearing or stretching of the tendon. The job of this tendon, the posterior tibial tendon, it holds up the arch of the foot. And as you can see, an example of this foot right here, this is a foot that has collapsed down. You can see in the inside of the arch how everything is collapsed. And that makes it very difficult for the tendon to do its job. It's trying to pull up on the arch. It can't do it, and it becomes fatigued. And when we talk about straining of tendons or ligaments, initially there's a grade 1 sprain, which is where there's stretching or small little tears. The tendon pulls really, really hard in the arch of the foot. It can't do its job. The tendon becomes strained or stretched out a little bit, causes little tears. The normal tendon becomes a little bit thinner because it gets stretched. And then as it gets a little bit worse, it develops little tears. Now, this picture isn't the best picture to explain it. Most of our tears in tendons like the posterior tibial tendon aren't kind of through and through. This is called a through and through tendon tear. Normally, the tendon tears are actually the lengthwise, so going the long way down the tendon, and you can get little split tears, we call it. If you can imagine, if you have some string cheese and you kind of pull off the little strings, and that little split tear could happen in there. And those are the more common types of tendon injuries that we see in the posterior tibial tendon. And there's also another tendon on the other side called the peroneal tendon, or in the back called the Achilles tendon. And this, what happens is if this sprain gets bigger, these two little dots, these could create one lengthwise, we call it, tear in there. That's a larger, but it's still incomplete. And then you go on to grade 3, which would be a totally complete tendon tear, which isn't all that common unless it's in the Achilles tendon. That is a common one that can happen in the Achilles in the back, where the tendon doesn't work at all. Most of our patients, they have these type 2 or type 1 tendon tears. Tendon tears can be painful, but many of our patients with a very common flat foot, they can develop this and they just get used to it. They have this flat foot, they have this tendon pain, they're just used to it. What are some of the ways you can treat posterior tibial tendon? By the way, I'm going to put a little video here. It's going to go specifically about posterior tibial tendinitis. If you want to learn more, I have a little graphic there that explains all the treatments, but let me keep it simple. You can treat the tendon tear, this partial tear, with icing, with anti-inflammatories, but that doesn't work all that well if it's really torn, frankly. Cortisone can make it feel better, but it doesn't do anything with treating a tendon tear. And hence the question, can you treat it with shockwave treatment? What is shockwave treatment? Shockwave therapy is a treatment that takes this injured tendon area and you actually injure it even more. You take it and you take sound waves and you hit it specifically at that tendon, and that is supposed to produce growth factors and healing factors that can help the tendon repair itself. When I do it in our office, I usually do between 3 and 6 treatments, and we have both something called a focused and a radial shockwave. I'll put another link here as well, which is some more information about shockwave afterwards if you want to learn more. I don't want to go too much into shockwave. Shockwave does a really good job at repairing chronically injured tendons. And specifically, It can repair the lengthwise ones and can repair some of these. I guess there's little partial tears. They can repair it, but let me give you a caveat. It's not just the Shockwave by itself. You need to be in some type of an appropriate shoe, because a shoe is going to stabilize your foot, or an orthotic, or something called an ankle foot orthotic, which is an insert with an ankle brace attached to it. All of these things are very important to reduce the stress going through that tendon again. If you get it healed with the Shockwave and the person continues to have that collapsing foot, very commonly it can continue to get re-injured or not repair itself completely. Also, a walking boot can help. And then the last option is to do a flat foot reconstruction, which is a surgical procedure to fix the flat foot that takes tension off the tendon. And during that treatment, it can be repaired at the same time. I hope this is helpful. I'm going to put two little videos or kind of other videos you can watch. One's going to be on posterior tibial tendinitis or flat foot. And then the other one is going to be on Shockwave, so you can learn more about that. Once again, please subscribe if you're not subscribed to this page. Put any comments underneath, any questions. This is how I get the information for most of my videos that I've been doing lately. You ask me a question, I'll try to answer it. I'll answer it below, but I'll also, if it's a good one, I will make a video on it. Once again, thank you for watching this. Hope you found it beneficial.